Monday.
Good afternoon, everyone, and thank you for joining Webinar Friday here for the ADMS Compliance Department. Can I just get a verbal from anyone on the phone right now that you can actually see a screen on your computer at the moment?
Yeah, I see it, boss.
Very good. Thank you, everyone. What I'm going to do is I'm going to mute everyone's phones for the time being during the course of the presentation. And then when we conclude the presentation, we'll give everyone an opportunity to either ask questions or verbally, or ask questions through the chat box, which exists in the lower right-hand column of your GoToMeeting screen. So let us begin momentarily. And again, thank you, everyone, for joining the ADMS Compliance Team's Webinar Friday for today, October 21st. Well, good afternoon, everyone. Again, thank you for joining the ADMS Compliance Department's Webinar Friday. Today is October 21st, 2016. The Office of Compliance and Regulatory Affairs is staffed by William Cundiff, Ricardo Sime, and Alexander Osorio. And the ADMS Compliance Hotline, all of you know, is 718-483-7403. Once again, 718-483-7403. First off, we'd like to thank the ADMS Information Technology Department for their time in reviewing and providing input into today's reservation. So thank you, Victor Paris and team. Today's program is on bringing your own device, BYOD. Is BYOD a benefit or a disaster to the organization? And we'll talk about some of the pros and cons about using your own device in a healthcare setting. So first off, let's get to know you. Please note that the terms Atlantic Dialysis Management Services and ADMS in this educational program refers both to the specific organizations and to its contracted network of affiliated dialysis centers and physician practice locations. Today's learning objectives. After today's sessions, the expectation is that participants will be able to, number one, define the concept of a BYOD, or bring your own device, understand the current BYOD culture at Atlantic Dialysis and its facilities, describe the benefits and risks of BYOD in the healthcare workplace, and also identify best practices for a BYOD program. First off, everyone, please be advised that this program is being recorded and will be posted on the Atlantic Dialysis website at www.atlanticdialysis.com. Once again, today's program is being recorded and will be posted on the Atlantic Dialysis website with all the other compliance programs from 2016 at www.atlanticdialysis.com. So exactly what is BYOD? Bring your own device. BYOC, bring your own computer. BYOT, bring your own telephone. What exactly does it mean? So what are some of the benefits of bringing your own device to work? And some of you have expressed these individually. Some of them expressed it as a team, as an organization, based upon your facility. So increased productivity. Well, first off, using your own device, you've got the latest technology, right? You've also got the most up-to-date applications that either you or your colleagues or your friends are comfortable with, know well, know how to use well, can maneuver quickly. Also, workforce mobility leads to differences and increases in employee satisfaction. People able to do things quicker, people able to do things in a different manner, people able to do things in a position where you feel some ownership and control. That increases your satisfaction of what you do and what you can do. And also has caused workforce mobility, is also called a role change. It's caused people now to be essentially mobile workers. What once forced us to do by sitting at a desk in your cubicle or workstation or your office in front of a computer now gives us the opportunity to be in front of patients, be in front of our colleagues, ensure a level of customer or client satisfaction, and still be both productive and efficient. And of course, by using your own device, a BYOD, there's also cost savings involved, right? The company is not involved, or the organization is not involved by having dedicated equipment purchased for you. You're able to use your own hardware, right? And more importantly, if something goes wrong with your phone, your tablet, your device, your computer, you know what best need to do, whether you need to defrag, whether you need to disk clean up, whether you just need to reboot it, or as Richard Espinal says, know how to turn it off, turn it on. You know how to do that, and therefore you can decrease your support. So those are some of the benefits of bringing your own device to work. What about the culture of BYOD? Well, it starts quite honestly with the consumerization of information technology. IT is just not purely a business issue. IT and the concept of computers does not go back to the day of big box scenarios. No more than 5 or 6 years ago, there were 290 million smartphones and 18 million tablets sold in a given year. That's 5 or 6 years ago, and that seems like an awful lot. But in 2014, about a year and a half ago, on Apple's release of, at that time, the latest iPhone, there were 4 million iPhones sold on the first day. And this past year, it's reported that the number of mobile devices worldwide has grown to over 2 billion mobile devices. So you know at some point in the workplace, we are using that, whether we want to or not. So the culture of bringing your own device to work is here. The concept now we need to address is how do we both use it productively, how do we use it efficiently, and at the same time, how do we ensure that in this world of regulatory burden and environment, how do we adhere to all the regulations that we're responsible to adhere to and still ensure patient safety and satisfaction? Oh, pardon me. So let's talk about what are the risks of bringing your own device to work, and there's plenty of risks. And the first risk of bringing your own device, obviously, you've got security issues, right? At some time, you may be checking or communicating, whether it be through text or email, looking at a patient information or communicating, right? So there's always the possibility of your machine being hacked or broken into, right? There's also the possibility of you could lose or someone can steal your personal device. It doesn't take much, given the size and the weight. You put it down on the desk and you walk away and you come back, right? You leave it in your automobile with the car unlocked and you go into the 7-Eleven across the street or on the corner or the local deli shop to get a bite to eat, and you come out of the store and you go into your car and you find it's not there either. So security is a big risk. You've got human resource risks, all right? Labor laws, you know, are you working after hours? When you're checking your emails in the middle of the night, over the weekend, after hours, there are labor laws that adhere to and apply to whether or not by checking your email, responding to email, sending text messages, answering text messages, are you essentially working after hours? And are there legal ramifications and liabilities both to the organization as well as to the employee for that? And also, by doing certain things, if you're being reimbursed for these extra hours or by sending emails or text messages and you're being paid for that time or for those activities, are those considered taxable income? You know, yes, maybe you should be paid for those items under certain laws, but at the same time, does that have to go on your taxes? Do you need to claim that? Does it need to go through on a year-end tax statement to you? And do you need to claim that on your tax returns, whether it's an IT, a 204, or your 1099, whatever it happens to be? Another risk issue deals with legal implications. Legal implications. And one part of that is the confidentiality of corporate information, whether it's business information, whether it's the use of protected health information. You know, there are legal implications. You know, did you happen to email it to a business file that you were working on to your Yahoo account because you know I'm going to work on it this weekend? You know, and it's on your phone, or you downloaded that spreadsheet or that memorandum on your phone, and there's patient data, or there's corporate business data on your phone, company tax identification numbers, and that's on your phone. What happens if that phone gets lost or stolen, right? And then again, the storing of that sensitive information on personal devices, photographs. Recently, we had an issue where some iPhones were set up in an iCloud environment, and a number of people were located in the same network, and everyone was getting copies of everyone's photographs, phone calls, contact information, text messages, before someone picked up and said, hey, we got a problem here, Houston, we need to fix this. So the storing of sensitive information on a personal device is also an issue of legal implication. And then you've got hidden costs which come with bringing your own device to work. The IT department, what is the level of IT involvement? How do we address our network infrastructure? How is that protected? Do we have support systems in place? Can our current IT department handle the multiple device users that we have, whether it's a phone, whether it's a tablet, whether it's a computer? Application usages, are there license issues we need to be aware of? We pay for a certain number of licenses. Are there application uses? And then, is there compliance management? How does the compliance department at ADMS, how do the 4 corporate officers at ADMS corporate get involved? How do the 13 dialysis center compliance officers get involved in working in a BYOD environment? How does the compliance officer from Matuambot Medical Associates PC, how does that individual get involved in compliance management when his or her employees and doctors may be using their own devices which may contain corporate information and protected health information? So those are some of the risks which come along in a BYOD environment. So let's talk about personal mobile device use in a clinical setting, which is what we're all in. Many healthcare providers are struggling right now with what to do about their employees and privileged clinical staff and how they use their own mobile devices in the workplace. And some questions we need to think about and talk about. So first off, what is our organization's position on bringing your own device to work, or BYOD? And we'll answer that question. Does the facility you're in, does the corporate office you're in, does it have a policy that speaks to whether or not the organization allows the use of personal devices? And then does HIPAA allow the use of personal devices to transmit or store PHI? Again, HIPAA, not HIPPO. Remember, HIPAA is not the female status of a hippo. So HIPAA is the Protected Health Information Act that we've been talking about recently. So mobile devices and protected information. So what's the law say about using mobile devices and health information and PHI? Well, quite honestly, there's nothing in HIPAA that states it is not permissible to use a personal device to transmit patient information. However, the HIPAA security rule states that it is very clear that patient information must be protected and used securely by a covered entity, whether at rest, in use, or in transmission. A covered entity is an institution or an organization or an entity in which the patient seeks care. Therefore, the dialysis center is considered a covered entity when it's seeing the patients. The medical practice, Matuambot Medical Associates PC, is considered a covered entity. So that's that situation. So the problem at hand sits at who owns that phone or portable device that the protected health information is being seen on or downloaded on, and how can a covered entity enforce that proper security is on device if the dialysis center doesn't own the device? So let's talk about some common conversations we've had and heard either through the IT department or through the ADMS compliance hotline regarding mobile devices. So some common feedback is, to the left, you'll see, if I need to text the doctor some information about a patient, it's the same thing than calling a doctor. And our response has been, well, texting and phone calls are two very different modes of communication with different levels of risk, right? When you text something from your mobile phone or mobile device, it doesn't have appropriate security, and that information is stored electronically in your phone's cloud storage and can be hacked. Okay. Other feedback has been, I'm under a lot of pressure. It's easy to text the other doctors and nurses when I need to tell them something. Maybe the dialysis center should look into purchasing us some better technology to use. Well, our response has been, while the convenience is tempting, fines for violations of HIPAA issues and HIPAA rules have jumped from $50,000 per occurrence to over $1.5 million in the last year, which is why the ADMS compliance office and the compliance office at the local level have been discussing a lot about HIPAA issues. Most of the fines that have been given recently have been given by the Office of Civil Rights, and they involve violations of the HIPAA security rule, and that PHI was found discovered on the internet unsecured without passwords. Another comment we've heard is, I've told our IT department that I was using my mobile phone to text, and they said they wanted to give me the rights. They wanted the employee to give them the rights to that person's phone, so that way if it gets lost or stolen, the IT department can wipe it clean remotely. And the patient said, I don't think I want to give them this right. It's my phone, it's my device. And our response is that, yes, it may be your device, it may be your phone, but if you're texting protected health information, it's the organization's patient information. So therefore, you're putting your organization, your dialysis center or practice at risk if the device you're using to text your doctors and nurses is lost or stolen, and you don't report it to someone. In order to use that device, it would help if you would give the ADMS department the opportunity to remotely wipe it. So if you do identify that your phone has been lost and stolen and you can't identify it, they can wipe that phone clean, that information would be removed, and it would not put the organization or yourself under the Yates memo, would not make you liable or responsible for any fines that come from the U.S. Office of Civil Rights. And again, we'll give everyone an opportunity a little later on in the program today to ask any questions or comments regarding mobile device usage and BYOD. Also, let's talk about, how is the organization coming up with a position on the use of smartphones in our organization? So with respect to the use of smartphones, many organizations are aware that our employees in the clinical areas are using their personal mobile devices to communicate information. But how are the organizations dealing with this? And from our perspective, what we've been talking about is we can't pretend like the issue doesn't exist, because if we do that and something occurs, it can cost our organization big time in a number of different ways. So our position, the Atlantic Dialysis Management Services position on the use of smartphones, and this applies to ADMS corporate, the dialysis center facilities, and currently the Matuambot medical practice facilities. And the ADMS IT department has stated that it currently does not support bringing your own devices to work, and that the information presented today is to educate and answer the current questions regarding personal smartphone usage in the clinics. All ADMS issued devices encrypt emails, as you know, and also all text messages. Again, that's ADMS issued devices. Encrypt emails automatically, and also text messages through Cisco IronPort and a program called Tiger Text. The ADMS IT department will continue to upgrade the faulty or dated equipment to eliminate current issues. And some examples of that they just want to discuss and want me to advise is the upgrading of the dialysis clinic phone systems to a Broadview network, and also moving from a BlackBerry to the iPhone upgrades. Questions or comments about the position of the use of smartphones within ADMS and its affiliates should be directed to the ADMS Information Director, Victor Perez. Let's talk about steps to compliance. So, does our organization use a VPN or a virtual private network? And a VPN is a way for employees to secure the network and work remotely in a secure environment, and VPNs allow the employees to text securely, access patient information securely, and email securely. So those of you who have a BYOD environment or have laptops or tablets or phones, look for the network, all right? And there is a network. It's whether it's Atlantic or the dialysis center network. Log into that network with the appropriate password. That will ensure that you're secure on the network. Again, and you can comfortably and safely text. You can comfortably and safely access patient information through any of our systems, and you can also email securely. All right, so use the VPN where necessary and where you can. Okay. Let's also understand what can put a patient's information at risk, please, and this is very important. You've heard some stories about things occurring at our annual compliance training, and those of you who are new to the organization listening today, you'll know about them as we go through the compliance training in a few weeks. But here are some of the risks that many don't think of when we talk about dealing with your mobile devices at work. And again, it's not only employees. This conversation today is also directed to the clinical, the clinical staff within the dialysis centers, which are your doctors, your NPs, and your PA. So in some situations, devices get lost. And when a device gets lost, is the employee reporting the loss to their employer? Are your employees reporting the loss to you as a facility administrator, to the charge nurse, to the ADMS IT department? Right? Even if the phone belongs to the employee, especially if they're accessing patient information. Devices can be stolen. So, one question we ask is the IT department enforcing the wiping capabilities on personal smartphones in the event they are lost or stolen? And these are things we're working on right now. Is your own personal phone that you're using, that you may be texting your doctors on, that you may be viewing medical records or business records on, is your own phone password protected? You'd be surprised to know how many people don't have passwords on their phones. Depending on the type of device, there's malware, there are viruses, And those are potential threats that can be introduced into the workplace. Last week, I received an email that was purported to come from the Chief Nursing Officer of Atlantic Dialysis. And it says, Bill, you need to click on this. And it's something, you know when something is wrong. And I called her right away. And I said, Mayette, is this really something I need to click on? And we alerted the ADMS IT department that, we've got a virus within the system. And we'll notify individuals. So, malware, again, and viruses are threats that can be introduced into the workplace through your smartphone, through your tablet, through your personal computer. And do you, as employees, do you as credentialed clinical staff members understand that using a free Wi-Fi service when outside of work is dangerous, and that you can expose any protected health information on your device to potential theft or loss? So if you downloaded a spreadsheet on your personal computer, your laptop, because you need to work on the 2017 budget for your department or for your business office, and then you say, you know what, let me go to Starbucks and get a cup of coffee and a scone and let me work on this tonight for a couple of hours, and you're in a free Wi-Fi environment, that business information, the revenue, the expense side of the organization may be at risk. Any downloading of protected health information, patient data that you have, names, addresses, phone numbers, social security, ailments, comorbidity issues, that can all be exposed in a free Wi-Fi environment. So please be careful. Some simple steps right now that we're going to ask you to take in order for your organization at the local level to achieve compliance. First off, on your mobile devices and personal devices, use a password or some other type of authentication method. Authentication is the process of verifying the identity of a user. And your mobile devices can be configured to require a password, some type of PIN number, some type of passcode to gain access. And if an unauthorized user attempts to gain access and doesn't have the right password or PIN, right, the mobile device can activate screen locking, which will disallow any more attempts to gain access to the device. Another step, or a second step, will be, make sure you install and enable encryption systems. And encryption protects health information stored and sent by mobile devices. Some mobile devices often have built-in encryption that can be activated or encrypted and can be purchased for a device. And quite honestly, the amount of the cost, if you need to activate it or purchase, is minimal or de minimis compared to what, unfortunately, the penalties may be if you don't and something happens. So, again, find out from the ADMS IT department what our encryption policy is, what our encryption capabilities are, and whether or not they can help you with encryption for a BYOD here in the workplace. Make sure you can install and activate remote wiping and or remote disabling. Again, remote wiping enables you to erase data on a mobile device remotely. And this can permanently delete data stored on a lost or stolen mobile device. Pardon me for the typo. Again, remote disabling enables you to lock your device until it's recovered. So wiping enables you to erase the data on a mobile device remotely, and remote disabling allows you to lock your device until you can locate it. The fourth step, disable and don't install or use any file sharing applications. Let's be honest, we've all done it at one point. Somewhere on my personal cell phone, I know I've got music sitting on there that I use for the gym. So we've all done file sharing applications. And file sharing is a software or system that allows internet users to connect to each other and trade computer files. But file sharing can also enable unauthorized users to access your laptop, your handheld device, or your phone without any knowledge. By disabling or not even using any file sharing applications, you will significantly reduce a known risk to the data that exists on your mobile device. The fifth step, install and enable a firewall. A personal firewall on a mobile device can protect against all unauthorized connections. And what a firewall does essentially is intercepts incoming and outgoing connection attempts, and it can block them or permit them based upon a certain set of rules. Within the ADMS Information Technology Department and the ADMS Compliance Office, we have our firewall on emails, and we conduct a bi-monthly, or I'm sorry, pardon me, a semi-annually audit of all email addresses in which they are permitted to go out or to receive emails without going through the firewall. These email addresses have to be reviewed. They have to be approved by the managing supervisor, and there has to be a written justification why. Why must this email address not be, why must it be free of going through the firewall or the sending or receiving? And in some situations, it may be because we're sending or receiving information from a governmental authority as part of treatment or payment or operations, and they will not answer an encrypted email or an email coming through a firewall or from a firewall. So we need to understand why, and we do that. So that way, if you're attempting to log in under someone's Yahoo account, or someone's Yahoo account is not going to run through the firewall, we may see that in one of our semi-annual audits, and we're going to ask the question why. Why was this approved? Why is it happening? Who is this individual? What is the reason that it's unencrypted? So again, step 5, work with the ADMS IT department if necessary, and make sure you have a firewall, or if you have a firewall and it's not enabled, enable it. Step 6, install and enable security software. Okay, and you'll see that Norton and things along those lines. I'm not advertising for these folks, but security software can be installed to protect against malicious applications, viruses, spyware, keystroke loggers, and other malware-based attacks. Step 7, make sure you keep your security software up to date. It does expire. Your access rights do expire after a while, so make sure you regularly update your security software. Okay, and if you're getting error messages even on your personal computers or your work computers in the office, your laptops, your desktops that you have authorized, let the ADMS IT department know through the Zendesk application. Right? You currently have the latest tools to prevent unauthorized access to health information on or through your mobile device. Take advantage of the opportunities and the tools and resources offered to you. Step 8, research your mobile applications and your apps before you download them. A mobile app is a software program that performs one or more specific functions. Before you download and install an app on your mobile device, verify the app will only perform those functions you want it to. If you don't know if the app is okay to download or okay to use, ask someone from our IT department. Of course, only use those known websites or other trusted sources you know is going to give you reputable reviews of the application. Step 9, of course, maintain physical control of your devices. You know, the benefits of mobile devices, the portability, the size, the convenience. Not only is that great, right? You're walking down the street, you can answer the call, text, you can get directions on where to drive, you can send an app, you can do everything, and you can check a Yelp review for the pizzeria on the corner, all at the same time while you're standing at the street corner. But there are also challenges that come with protecting and securing that health information. Again, mobile devices are easily lost or stolen. I'll be the first to admit it. Yes, I put them down and I forget what I do with them. But there's also a risk of unauthorized use and disclosure of patient health information. We've talked about that often, about accessing systems through sharing passwords and logins. Again, by leaving your phone available and not having any security of passwords or PINs, and you lose that phone, it can be very easily hacked or very easily turned on and accessed. So there's a risk of unauthorized use and disclosure of patient health information, but you can also limit an unauthorized user's access, tampering or theft of your mobile device when you physically secure that device. And again, we're going to refer everyone to the ADMS IT department or call the compliance hotline if you have questions. Once again, 718-483-7403. Step 10, use adequate security to send or receive health information over those public Wi-Fi networks. Public Wi-Fi networks are tempting to use because, of course, they're free. But that's an easy way for unauthorized users to intercept your information. Okay? You can protect and secure health information by not sending or receiving it when connected to a public Wi-Fi network unless you use a secure encrypted connection. Step 11, delete all stored health information before you discard of or reuse the mobile device. At the same time, I just want to give everyone an advisement that the photocopy machines in each of the dialysis centers and the business offices, when those photocopy machines are changed out or swapped out for new machines, the ADMS IT department either secures the physical hard drive in its possession or receives a statement that the hard drive on the copier machine has been wiped clean from the vendor. We do that because there have been instances found where some companies, not ours, where some companies involved in healthcare, the copy machines have been changed or moved from, and the vendor says they've wiped things or they've taken the machine, and then they find in the news that the copy machine is being sent to another entity or another location. That IT department receiving the copier checks the hard drive, and there's been situations where they found patient health information on a new machine that was never wiped or destroyed. So the ADMS IT department either requires a physical hard drive in its possession, which it keeps offsite in a secure storage facility, or it requests a validation and certification statement stating that on such a day and such a time, the hard drive within the copy machines have been destroyed and or wiped cleaned. Again, speak to your ADMS IT representative in your facility. Speak to the IT director, Victor Paras, if you have questions about that. But once again, delete all your stored health information before discarding or reusing your mobile device. When you use software tools that thoroughly delete or wipe data stored on your mobile device, before you discard or reuse that device, you can protect and secure any health information from unauthorized access. The Department of Health and Human Services, the Office of Civil Rights, OCR, has provided certain levels of guidance that discusses the proper steps that you need to take to remove health information and other sensitive data stored on your mobile device before you dispose or reuse of the device. Call your compliance representative in your facility, call the compliance hotline, and we'll give you a copy of that OCR information. Again, if you're unsure about how to make sure your device is sufficiently wiped when you get a new one, ask our IT department with help. So the question is to bring your own device or not to bring your own device, BYOD or not to BYOD. It's not a matter of when to allow your employees to bring their own devices to work. More importantly, from a management perspective, it's now a matter of how we are going to manage a BYOD in the workplace. That's what we as managers, that's what we as leaders within our organizations need to deal with at this point. It's not a function of when, now it's a function of how. For more information, to schedule a live presentation at your location, or to discuss any part of the ADMS compliance program, please call the ADMS compliance officer, William Cundiff, at 718-483-7428. Once again, direct line is 718-483-7428. Our next webinar training is going to be on a webinar Wednesday. Compliance training will occur on November 30th, 2016 at 11 a.m. And on that day, we're going to discuss the exclusionary rules. You've heard it spoken about at some of the compliance training. You've read about it. We've discussed it. Compliance training is mandated. It's a background check on all employees and staff members, clinical staff members. It's conducted on a monthly basis. So we'll talk about what it is, what it means, what's the ramifications if you're found to be on the exclusionary list, and how to address it. Again, be aware that your mandated annual compliance training is coming soon, December 8th to December 19th. I see everyone writing down those dates on your calendar with a big smile. December 8th to December 19th is your mandated online compliance training. We're working on the compliance program now. We've added some areas including cybersecurity, business ethics, dealing with vendors, social media in the healthcare workplace. We've got some great programs and topics. So that program will be coming soon, and the period in which you'll need to complete that training will be anywhere from December 8th to December 19th. It'll be a time training, and there is an exit examination that you will need to pass in order to complete your annual compliance training. So that information is coming soon. I'd like to thank everyone at this point. What I'm going to do is I'm going to unmute the phone at this point, so you can either ask some questions through the phone line, or if you're in front of your computer, there is a chat box in the lower right-hand component, and what you can do at that point, you can speak, and we'll take it from there. So let me unopen this, and the lines should be open.
A bunch of dummies there.
Hello?
The restart is due in October. The cover drop on the 5th.
Hello, Ms. Shako. Please watch your mouth, Ms. Shako. So anyone with any questions or comments right now on the ADMS compliance program today. This program is being recorded once again, folks. If they have no questions, what we will do, the ADMS Compliance Department with the ADMS IT Department, we will post those items on screen.
It's on the computer.
And we'll post that on the ADMS website within the next week. Again, any questions or comments?
My email wasn't working.
With silence being noted, folks, I'd like to thank everyone for their time today. Have a wonderful day and a great weekend. Thank you, everyone.
Okay.